This video is for instructional purposes only and does not replace the use of the owner's manual. Patients need to consult with their physician or other healthcare provider prior to using this product. Introducing Invacare's G-Series bed, the first home care bed in the U.S. designed to meet the latest standard for patient and caregiver safety with hospital beds, IEC 60601-2-52. This standard is recognized by the Food and Drug Administration, Health Canada, and throughout Europe, and encompasses a broad range of standards from the IEC 60601 family, including IEC 60601 3rd edition, IEC 60601-1, and IEC 60601-2-52, the standard that pertains particularly to hospital beds. Best of all, the bed assembly is virtually the same as other Invacare beds, making in-home deliveries quick and easy. Start by connecting the head section and foot section together. Extend and connect the head section pull tube and set aside. Next, assemble the bed ends by installing the casters. Connect the bed ends to the bed deck. Install the drive shaft to the high-low motor at the foot end of the bed and to the gearbox at the head end of the bed. The G-Series bed features a number of ergonomic and design enhancements. Invacare lengthened the head section of the bed to provide more support under the patient's head when sitting up in bed. Likewise, the leg section was shortened to improve the fit and provide better support for most patients. Additionally, the link spring fabric was replaced with durable, easy-to-clean metal slats. These slats provide enhanced support for the patient, minimizing sore backs caused from excessive sagging. The slats also provide less wear and tear on the mattress. The bed ends underwent some changes as well. For better caregiver interaction, the bed deck now raises to a full 32 inches, bringing the patient up to a comfortable working height. The caregiver no longer has to stoop over to tend to the patient. The electronics have also been improved, featuring a streamlined design. While in use, the power supply is designed to remain close to the baseboards. A flat plug helps minimize damage to the outlets and is offset by 45 degrees to allow other plugs to be in use at the same time. This design allows just the low voltage line to be out in the main flow of the room. The power supply transformer is now located off the bed. The control box was removed. Now each actuator and motor is independently controlled through the hand pendant. The system features one bus cable running across the foot section of the bed. The actuators have a simple plug design that attaches to the bus cable. An O-ring on the plug ensures the system is watertight, preventing any fluids from entering. Simply align the flat side of the cable to the flat side of the port, push in, and close the connector. The pendant has been redesigned as well. The buttons on the pendant are now larger and are spaced farther apart to help prevent miskeying. The icons have been modified to be more intuitive with the function in use. The strain relief has been extended to help prevent damage to the wires. Power outages are not a concern with the crank through actuators. Simply disconnect the pendant from the bus cable and connect the crank handle to the actuators to move the deck sections or bed height up or down. Unlike battery backup, there's no limit to the number of times this action can take place for complete confidence in any situation. Bed rails for the G-Series bed have been redesigned to meet the IEC 60601-2-52 standard. Be sure to use only Invacare rails, mattresses, and other accessories with Invacare bed products. Bed accessories designed by other manufacturers have not been tested by Invacare. Use of non-Invacare bed accessories may cause injury or death. Proper patient assessment and monitoring, as well as proper maintenance and use of equipment, are required to reduce the risk of entrapment. Be sure to read the owner's manual completely prior to use. The rails for the G-Series bed are designed to be bolted directly to the frame of the bed. Doing so helps eliminate potential gaps from being created due to bed deck articulation. To raise and lower the rail, simply grab hold of the rail, pull the plunger pin out, and move it to the desired location. The half rails install in a similar manner, with the addition of a cross brace. Install the cross brace first, and then attach the rails. All rails are designed to help prevent entrapment. When the deck sections are articulated, the gaps between the various points remain constant. The rails also maintain a consistent height above the bed deck. A patient trapeze is available for the G-Series bed and has been specifically designed to meet the IEC 60601-2-52 standard as well. The trapeze can be installed directly onto the bed ends by attaching 2 brackets to the bed. Be sure the brackets are securely attached, and then install the trapeze bar. The trapeze installs in a pre-specified location, so it is ideally positioned for patient use. The trapeze handle features a soft, comfortable grip and is easily adjustable. Simply pull the rope outward to disengage it from the locking collar. Slide the rope up to raise the handle or down to lower the handle. The trapeze is designed to exceed the requirements of the standard and is safe for patients using the G-Series bed. With Invicare's G-Series bed, you will have the peace of mind that your bed system has passed stringent tests to ensure the highest standard of safety for patients and caregivers in the home care environment.